So let's start with what the foundation is and does, because a lot of our viewers may not know what Secure the Future is.
Sure. Secure the Future is a program of the Bristol-Myers Squibb Foundation. Foundation independent from the company, but is donated to by the Bristol-Myers Squibb company. So Secure the Future is a program. It was launched in 1999. It was at the time the largest private commitment focused on HIV/AIDS in sub-Saharan Africa. And really that program set out to do a couple of things. One was to really start to raise the awareness of what needed to be done in sub-Saharan Africa at the time, because there was a lot of inactivity going on. There was not much attention being paid to HIV/AIDS in Africa back in '99. But to really go in there and work with the national governments and people on the ground to really create a program in Africa for Africans.
Now give me an example of a program. So you go into one of these countries and what is it? Are you building hospitals? Are you educating providers?
Secure the Future in the beginning was pretty much set up almost like a venture capital sort of approach, right? There were so many ideas out there in those communities. There was not a lot of funding to actually see those ideas come to life. So from a funding point of view, it was kind of like a foundation president's dream. There were smart people with great ideas that just needed to make things happen.
And I would imagine you go into these countries and, you know, as you said, there was some sort of question about your motive for being there. But over time, you're working with the countries and their leadership and the people on the ground, so you're building trust. And what did that do for their outlook on America in general?
I think it had a lot to do as we came in and started to work with the governments, and when I say the governments, I mean the ministers themselves of the 5 countries were part of the Secure the Future sort of planning groups. They had their own committee. Then we had half of our advisors were from the 5 ministries. So in a sense, we knew early on that we had to actually have them at the table.
And country buy-in.
So. Exactly. So it wasn't like we're trying to convince them of something. You are basically the response.
Right.
We're here to help empower you to do that. We have the funding, we have assets that we can also bring in terms of our knowledge, our people, to help inform the process so we can really get this moving. So in a sense, that really did lay the groundwork, at least in those countries, in terms of the response, which was difficult in the beginning. I mean, it wasn't more than a year or 2 years later that some of those ministers were actually, with us on our panels at, the World AIDS Conference, presenting the results of what was happening in their countries. So, everything else that came along was obviously significant, bigger, and important.
How do you go into a country and work with leaders without it feeling paternal, without feeling like you're telling them what to do, so to speak, when in fact they actually do need help? Because there might be young countries or young governments.
Right, and you always try to start as much at the top as possible. So access to the ministers themselves about what our intention is and how we really want to have them be full participants in this, so that it's their programs that we're helping to support. One of the big gaps that we saw in the early days of Secure the Future was really the lack of attention to the treatment of children. Working directly with the Ministry of Botswana, we, as a partnership between the Baylor College of Medicine, Bristol-Myers Squibb Foundation, and the government, created the first Children's Center of Excellence on the continent of Africa.
And showed that it could be done, and showed that it could be done well.
And showed that treatment can be done well, that children deserved the best treatment.
Once word spread that these drugs could prevent, your baby from becoming infected or could save your life, there seemed to be a big appetite, actually, even in the face of the stigma, for care.
Absolutely. That model, which actually demonstrated exactly what you said, has now basically grown to a 6-country network, and there are basically around 128,000 kids in care.
A lot of kids.
A lot of kids.
Now these are kids born with HIV because their parents didn't have the drugs to not transmit the virus?
That's exactly right. And of the 128,000 kids, I would probably say about 50% of them are on ARVs. The other ones are not treatment ready yet, but they're all in the network, they're all in care. And it's really powerful because of the community-based model that these centers develop. If that mother doesn't show up for the appointment with her child on a certain day, they are out into the field, they know where they are, and they know how to bring them back in again. So, we have a 1.4, 1.5 mortality rate in the network in some of the most resource-constrained environments on the continent, and that's what you would see in the developed world. So, treatment is extremely important. But your point is a very good one, and it kind of leads to where we are with Secure the Future now, and that is really how do you start to break down those barriers at the community level, and that is the fundamental platform for the Bristol-Myers Squibb Foundation. How do you look at the mobilization of community support services, and that can also include human resources, to get greater health outcomes. So whether we're working on HIV in Africa or diabetes in the US or oncology in Central and Eastern Europe, the community-based platform is everything we work off of. Right. And then we were able to really kind of model that in, with 6, I guess, diseases in 4 geographies to learn global lessons. A lot of the work we did on community-based care in Africa really took a 3-country approach to really try to understand what is needed in communities, especially resource-constrained environments. Because you say to yourself, it's kind of interesting that a pharmaceutical foundation would really focus more on the community than they would, in the physician's office.
Right, it seems counterintuitive. Wouldn't you be pushing pills through the doctors and then into people's bodies?
And if you look at what happens from a lot of companies, including Bristol-Myers Squibb on the commercial side, a lot of the focus of what they do is in the clinic and the physician. I think the beauty of what we're able to do is, kind of say to yourself, look, you could be HIV positive, you can have all the medicine you want, but if you're living in a village in Swaziland, or you're living in the suburbs or in the inner city of Chicago, and the stigma is too high, you don't have the right nutritional supplementation, you're just afraid of what this all means, you never benefit from those interventions. So how does a foundation like ours help bring down those barriers so that people can ultimately benefit from medical innovation? And in many cases, how do you actually look at that so that they don't even need medicine? And I'm not talking about people who are perhaps HIV positive, but how do you work on the prevention side in terms of these communities to really prevent people being affected in the first place? We did these models on community-based care. We built out this Cadillac model because we had the ability to kind of look at what was going to work and what wasn't going to work. We had really good outcomes. At the end of the day, I mean, was it really a scalable or replicable model because there were just too many services? Right. So we were able to kind of go at that and really start to look at how do you prioritize, and which ones really are the ones who had or those services that had the greatest impact? And it comes out, it was basically the home-based care individual, the community-based healthcare worker who could attach themselves to someone. Right. Even if it's the peer navigation system, in terms of connecting with somebody.
Just a human being there who's going to walk you through the process and check on you, make sure you're taking
And the
meds.
nutritional supplementation in Africa was very important.
Right.
So the whole idea about building out communities, and it's the self-management. Let's face it, if you're infected, you have to really kind of be able to work with what happens in the clinic.